So, so the agenda, we want to, the agenda for my presentation, and I should say that our content is pretty presentation heavy. And then tomorrow we'll be doing a lot of the discussion time. Okay, so we'll present a lot of the content and then we'll have the discussion tomorrow. So what I'll do is I'll review the background of the study, and then I'll talk about the hypothesized model. I'll give the key findings for this 2022 to 2023 study, and then I will review this more detailed study results. And then I want to show how we build a model of measurement for the retention. So why are nurses staying today? And then we will talk a little bit about the CSI plan and strategy. So now this here is a pretty busy model. This is called a structural equation model, and this was our 2019 to 2021 study. Now, don't worry about understanding all of this. This is a lot of matrix algebra and correlations and lots of math. But what this tells you is there's so much information in a structural equation model. For example, here you see caring of the manager up here in the top right, okay? This care MGR, that's the measurement of the caring of the manager. And you can see that it is pointing to four variables. So caring of the manager predicts satisfaction with coworkers, it predicts autonomy, it predicts satisfaction with professional growth, and it predicts communication with the manager. So the caring of the manager impacts all of these job satisfaction variables. So we have coworkers and participative management. Those two are social variables, and autonomy and professional growth, that is technical resources to do the job. So caring of the manager is very important. You're going to hear that as a theme throughout this, that caring of the manager is so important. Now here you can see that caring for self, this is in the bottom right, you can see that caring for self only predicts one variable, caring for the patient. Now this is consistent with Gene Watson's theory that in order for us to care for others, we have to care for self. How can we give out to others if we're empty ourselves? We need to be full so we can give to others. And so this supports her theory. And I should say that Watson's theory, we use it globally, except in Western Scotland. We have those silly Scots, right? So, but we did find, though, that we used some caring concepts from their 2010 compassion report or caring report. And so we did find a theoretical framework that fits for Scotland. So they are included in the international study. Now here you can see caring for self and caring of manager both predict clarity. So, and clarity predicts all the variables except professional growth. And you can see organizational rewards. That's what this is, the professional rewards. Organizational rewards, that is not predicted by anything, but it has a good fit in the model. So it is part of well-being. Now, this was our hypothesis and initial testing in December of 2022. So once we reduced the 97 item of the profile of caring, we reduced it from 97 items to 35. And so for this year, we wanted to understand, now that we had a short survey that measured about that explained anywhere from 75 to 80% of well-being in every country. Oh, and I should say, what was important was the this model here. This had good model fit in every single country. We did both reliability testing, so it was understood by at least 80 to 90% of the nurses that it was about well-being, and we did construct validation using confirmatory factor analysis, which is structural equation modeling is, and we used invariance testing. Invariance testing is a way to test for bias. So we looked at Scotland and how that compared to Israel. We looked at how Israel compared to, the other countries. So we looked at all participating countries to make sure there was no bias, and it is an unbiased instrument to measure well-being globally. So that's a very important part. We tested the Jesus out of this. That means we tested it a lot. If you don't know that word. Okay, and so we found that the hypothesis was true for sick time. We found that, and this was only, I think it was 4 countries in this preliminary analysis. We had about almost 1,400 nurses in this stage of the research. It was about halfway through, and we found that well-being predicted sick time. It predicted about 4%. We found that well-being predicted turnover about 34%, and we found that well-being predicted post-pandemic trauma about 5%. It had no relationship to difficulty in working through the pandemic. And notice over here, we also found that what country you're responding, that predicted well-being. So not everyone has high scores of well-being around the globe, but we'll talk more about that in just a minute. So some of the key findings for this stage of the analysis, and I just did this a few weeks ago. The last 6 weeks I've been working on analysis full time, and we have 2,042 nurses out of 2,670 who responded to all 35 items. So we had a 76% completion rate globally. The psychometrics, it performed very well as far as reliability. All of the subscales and the overall scale was 80, understood by at least 80 or more of the nurses. For exploratory factor analysis, we found that all of the items loaded with more than 40.40, and you want to have your factor loading more than 0.40 in this large of a sample because that tells you that item belongs. Okay, so it's important to have a loading greater than 0.40. But we found clarity was weak. And I don't think it's the instrument because it performed very well before the pandemic. I think nursing really doesn't really know what to do because it's such a hard time post-pandemic because they've worked in chaos for 3 years. And so I'm hearing all over the globe, they want education and we want to have pathophysiology again. We want to have instruction and policy and procedure because we don't remember what it was like 3 years ago, and I hear this all over the globe. And so when I included clarity, it only explained 74% of well-being, and when I took out clarity as a poor performing 4-item assessment, the explained variance of well-being increased to 77.4%. So there's something with clarity, I don't think it's the instrument. I think it is, we have got to do some more teaching and education about what are we supposed to be doing in our roles, in our pathophysiology, and in our policy. And this is very important, and you've heard me say it already, caring of the manager and participative management. Now, caring of the manager is a caring construct. Participative management is a job satisfaction construct, but they load together. So that means, and this is true globally, you'll see it in just a minute, nurses think about communication as a caring construct. So it's important that the nurse manager is not only behaving in a caring way, but that they're communicating because the staff see caring and communication as the same thing. And caring of the manager explained 40 of the 77% of the variance. So it is the big kahuna. That means it's a big deal. Another word. So here we can see the explained variance. These are all the subscales. So of the 77%, caring of the manager explained 41%. Organizational rewards, which does represent money, but it's really, am I fairly rewarded for the effort and good work? Okay, so that explains 12% of the variance. Patient care, am I feeling connected to the patient? And that explains 9%. Professional growth, that explains 4%. Teamwork or satisfaction with coworkers, that explains 4%. Caring for self explains 4%, and autonomy explains 3%. So that's the breakdown of all the explanations that we're able to provide for well-being at work for nurses and nursing staff. All of the constructs and subscales that we looked at had a range of 1 to 7. So we used a 7-point scale from strongly disagree to strongly agree. So the higher the score, the more of that construct or subscale it is. And we had all the way from 1 to 7. So it's a real variance or variety in well-being across the globe. We found that well-being had the greatest impact on intent to leave. So well-being is very important for decreasing turnover. Job satisfaction was the most important variable. It predicted 27% of turnover. So of well-being, the job satisfaction, the social and technical variables are the most important. And country predicted every outcome, including sick time, intent to leave, difficulty working through the pandemic, and the residual trauma. We find about half the nurses are still struggling with the difficulty they went through. And I hear this around the globe. Some units say we didn't have a difficulty, and others say that we did. But some nurses are really struggling. And it predicted well-being of work, country did. So now here are the response rates globally. And what's interesting is in the 2019 through 2021 study, we found that usually we would have the survey open from like 2 to 3 weeks, sometimes 4. Now we are finding that nurses are very slow to respond or don't respond at all. So it wasn't unusual to get a 60% response rate like they did in Japan this year. That was very normal. But now it's not unusual to get a much lower response rate. Here you can see 12%, 17%, 7%, 10%, 10%. So the response rate is much lower. Nurses are just tired. Okay, so in 2019 through 2021, we had 2,026 nurses from 22 facilities. Now we have 43 facilities and we have the same number. So we had to double our facilities to get the same number. Nurses are just very tired. The pandemic was awful, really, really awful. But I provided all the countries here, and you can see the US has several different systems that are included. And Colombia is still collecting their data. Croatia, because we sent it out to the Congress, which is like the Nurses Association, we are unclear on the number that it reached. And then US Denver, they have not sent in their numbers. But we do have the response rates for several, which I've already talked about. And then the completion rate was very good. For those that responded, we're getting about 75 to 80% of the all 35 items are completed. So if they respond, they tend to complete it. So this was really good. So you can see we had 2,600, almost 2,700 respond, and we had 2,000, just over 2,000 that completed it. Now this one I think is very interesting, but stick with me. This is a really informative slide. What this means is when you have a factor load, when you're doing a confirmatory factor analysis, the higher the load, if it enters into the equation first, that's more important. So the higher it is in the entry into the results, the more important it is. Now look at, and I put a key down here, but here we see caring of manager and participative manager. They loaded together in Croatia, and it was the most important of the factors. Israel, caring of manager and participative manager loaded together, and it was the most important. Same with Japan and Jordan. Here we can see in Russia, it was second, autonomy was first, and in US Trinity, it was second. You'll notice that the other one that loads first oftentimes is organizational reward. So they want to feel rewarded for the good work and the effort that they put forth. So you see organizational rewards at the second, Scotland second, Poland second, Israel second, Croatia second. So you can, and then US Trinity, it was first. So the two that are very important is they want to know that their manager cares for them, and they want to feel like they're rewarded for their good work and their effort. And what's interesting is when we, and I don't have that slide in here, but I want to comment, we asked them, name a time that you felt very rewarded. And oftentimes they'll say being thanked. I was thanked by a patient. I was thanked by a coworker. My boss thanked me. And it wasn't pay. Pay was like fourth. But they want to feel like they're recognized and rewarded for their good work. So if they stay an extra shift, just say thank you for that. So then I put in red, and so you can see down the line, each of them, that there isn't the same factor loadings. Now look at, for example, with, I think it was Denver. Denver, caring of the manager was fourth. And I think it was Jordan, no, it wasn't Jordan. Where was the other one? Caring of the manager. That was, oh, yeah, US Denver. That was the lowest one, I think. Yeah. So the point, and here we can see like Poland participative management, that was third from the lowest, but caring of the manager was top. My point in that is that it's important to have a conversation for your context and country and facility, because what's important in the country, in your country, and what's important in the city in your country isn't the same. So context is everything. So it's very important to have a discussion about your factors, the rank order, and how that might compare to the world. Because even though the model fit globally and well-being had a good model fit, what's important to nurses isn't always the same. So it's very important to have that conversation. Anything that's red, it had a poor factor load. So you can see in Japan, autonomy and clarity, which was already addressed in their presentation. That was, they didn't perform as well. But here for Poland, for example, clarity and patient care, that didn't load as well. So there's discussion that needs to take place for all of those. So this is a very important slide. So now the demographics, we can see that, and I'm not going to go through all of them. We have the range, that what was the youngest nurse and the most senior nurse, use that word instead of older, and the average age, and then the standard deviation, that's the variance or the spread. And so the mean age was 40 globally. The average age or years of experience on the same ward was 8 years. Average years in the same profession was 15. This is very similar to the Japanese presentation, isn't it? And then the hours worked is almost 40. But you can see the range. And we had 3 countries that 24-hour shifts is pretty common. I thought that was very interesting. I thought that was a typo. And so when I called and I asked, now it says 24 hours, did you mean that? And they're like, yeah, no, that's in order for us to get the nurses, they come in from the country and they work in the city. So it works for us because they work 24 hours and they're off 3 days. So, and Poland was talking about that as well. So here is that, so we had mostly females, 75% of the sample was female, 11% male, and then we had about 11% that didn't respond or didn't want to respond. About 52% were married and about 24% were single. Now I want to explain something to you here. This is important for when we look at predictors of the outcomes. When you see reference, that is the group that I am comparing everyone else to, and I tried to use the largest sample of the grouping. Okay, so instead of having a small sample I'm comparing, or a small size grouping and comparing it, you want the larger sample. So for females was a reference because there was 2,000 females and only 300 males, and so I wanted to compare the males to the larger group. Same with marital status. I combined the married and the domestically partnered. I called them partnered. And then the non-partnered was the single, widowed, and divorced. So I called that non-partnered. Now, these are all the countries that are in the data set. So you can see the N and the percentage for each one. Since Trinity Health was the largest with 730 in this sample, I used them as the reference. Now, here's all the mean scores of all the constructs and subscales globally in order. The first thing I look at on the 1 to 7 scale, 7 being more of that construct, is we see that all of them except organizational rewards are above 4. So this means there's more dissatisfaction than satisfaction for feeling rewarded for your effort and good work, and all the others are above. And then in order, we have satisfaction with patient care. How wonderful that the patient is the highest scoring one, even though we just got through the pandemic. So that's wonderful. Caring for self, co-workers, autonomy, caring of the manager, participative management. And what's fascinating in the factor loadings, caring of the manager was more important than communication with the manager. So it's more important that you have someone that's caring and doesn't really talk very well, instead of someone that communicates very well but isn't very caring. So I found, and that was true in every country. I found that fascinating. Profile of caring, which is all 35 items combined. Job satisfaction is 19 items, which is the 3 social and the 3 technical aspects of job satisfaction. Professional growth, and an organizational reward. And professional growth is so important because nurses want to relearn what they don't really understand because they've been working. And you think about some of the new graduates, they only have been practicing in chaos. So they only know this environment. And I hear that over and over and over again, that we have graduating nurses now that when they're the first ones that they were not doing clinicals directly because they weren't able to be in the hospitals. They weren't doing the regular protocols. They were just sort of surviving. So it's very important as a global collaborative that we have a conversation about how are these nurses doing, because we need to build the profession back and not try to just do tasks and go to the least common denominator. We need to understand how these nurses are doing and why they're staying in nursing and doing more of that to build them up. Now, these are the descriptive statistics. It's still similar to the bar graph you just saw, but it has a little more information showing you that we have in every country or globally, we have a 1 to a 7. So there is a real variety in how nurses are doing. There are some that are not doing well at all, and we have some that are doing very well. But that's what I find in the pandemic. We have some units that they're still emotional when they talk about it, and there's others that it wasn't really a problem, but it depended how much they were floating or deployed on if they were taking care of their patient population or new populations. So there was just a lot of dynamics that were going into that. Here is the mean scores, which we've already reviewed. And the standard deviation, if it's over 1, that tells me that there is a variety or a variance in their experience. And the highest variance is in participative management, in organizational rewards, and in professional growth. For sick days, on average, we asked them in the last 8 weeks, how many days did you call in? On average, they called in 1, but it was anywhere from 0 to 40. We had a mean of intent to leave. Now, intent to leave was a 5-point scale. That's the only 5-point scale we used. And the way that it went, it was number 1 was I never think of leaving. 2 was I occasionally think of leaving. 3 was I frequently think of leaving. 4 was I would like to leave in the next 6 months. And 5 was I'm looking for another job. And as soon as I find that job, I'm going to take it. So the higher the score, the more likely they are to leave. So here we can see the mean is 2. So that means they're occasionally thinking of leaving, but look at the minimum and maximum and the standard deviation. So we have some nurses that are out looking and they're going to leave as soon as they can. And then we have ones that they never think of leaving. As far as the difficulty getting through the pandemic, that was on a 7-point scale, 5. So, and a standard deviation of 1. So there was more difficulty than less. Okay, so this was tough for nurses to get through globally. And then the residual pandemic, it's over 4. So there are more nurses than less nurses still struggling with post-traumatic stress from the pandemic. So this is very informative. And look at our standard deviation, almost 2. So this is telling us that this was really a varied experience. Now, this is also very interesting. This goes through the differences of each of the outcomes predicted by country. Because remember, I said country predicted every outcome. So here we can see all of the, this is for well-being at work. So you can see that Western Wisconsin is the highest and the lowest is Japan, all above 4. So that's a good sign, but you can see that there is variation. Now, remember the US Trinity, this third one here, that is the comparison group. So when I compare everyone to the Trinity Health, down here, if it's red, it was less than the comparison group. So US Denver, the P level was 0.001. Turkey was less than, Turkey, how you pronounce it, is less than 0.001. Japan, less than 0.001. Croatia, less than 0.001. Jordan, again, less than 0.001. It was true for Scotland and Poland. So you can see that there was really some statistically significant differences from the reference group. Now, what I will say is you want to not only look at the statistical significance, because this is a large sample, so everything's really sensitive. So you want to not only look at the statistic, but you also want to look at from a practical standpoint. So they're 5.63 and I'm 5.41. Is that really that big of a difference? 0.2? I would say no. Now, if it were like here we go, 5.7 to 4.5, if it is 0.5 or 0.6 on a 7-point scale, it will always be statistically significant if the sample size is large enough. So what I use is if it's 0.5 or more on a 7-point scale, then I will say I would pay attention to this, okay? And then if down here on this bar, this little bar here, if it's black, that means it's higher. And if it's 0.035, that's nothing. And same with Israel, 0.013, that's nothing. Here's sick days. So you can see that the reference Trinity, on average, they had 1.61 days in the last 8 weeks. And you can see that the ones that were statistically significant, if it's 0.037, I would not really pay attention to it, only if it is less than 0.01 in this large sample. So I would look at Turkey, Japan, and Croatia as far as sick time. This is intent to leave. This is an important scale. Now you can see that we have Scotland, that's 2.4. It's a 5-point scale. So we have about half that are thinking of leaving, and we have about half that are thinking about staying, since they're right in the middle of the 5-point scale. In contrast to Russia, they are on a 5-point scale. So they are, they'd never think of leaving if they're rating a 1. But you can see when comparing the reference Trinity, which is right here, the 4th one down, you can see that the ones are lower is, or that are statistically significant is Wisconsin, in the US, Russia, Israel, and Poland. So those are all down here. So this is statistically significant, these bottom 4 from the reference. And here, this is difficulty working through the pandemic. So you can see that, and the higher score means the greater difficulty. So those in Jordan and Turkey, they had the most difficult in compared to Russia, which was right about a 4. When I compare it to the Trinity Health, which is the 3rd one from the top, you can see that the 3 that are statistically significant lower, I would look at Russia, Japan, Croatia, and Scotland. Okay. For the post-residual trauma, we can see that the reference is the 3rd from the top, and the ones that were statistically lower was Turkey, Russia, Croatia, and Jordan. Now, this is very interesting. When we look at what, as far as the demographics of what is predicting each of these outcomes, look at how you see both red and black. And that's because there is no consistent behavior of the demographics for these variables. So look at age, for example. So age, we see that in Turkey, it is positively correlated. So as age increases, well-being increases. That's true in Croatia, US Trinity, and in Poland. However, in both Japan and in Jordan, as age increases, well-being decreases. So it's important that when we are having a conversation internationally, that we're not just assuming this study from Slovenia is telling me that I should make this leap. It's all about context. It's all about your policies and your systems, etc. So this is a very important slide to illustrate how we're not all the same. Our well-being model was good, but what's predicting that well-being isn't always the same. So that's why it's important we have discussions about the intervention we're going to try. And this is for the let's see. Where am I going? Oh, I think that's duplicate. Yep. So this is sick time. So we can see that in the US, there were several variables that predicted sick time, whereas in Wisconsin, in Denver, in Turkey, in Croatia, in Scotland, there was nothing that predicted sick time. So again, sometimes when we look at the literature, we can't always rely on the literature, especially if it's from a different context. This is intent to leave. The demographics, it was only really predictive in Croatia and Poland, and then there was a few other things here and there, but generally in Wisconsin, Denver, Russia, Japan, Israel, and Jordan, there was no predictors for intent to leave as far as demographics go. And then here we go. This is the pandemic difficulty. So we can see that in Wisconsin, Denver, and Turkey, and Japan, there was no predictors, but there were some predictors. But again, you can see here, like for unit ward years, that was consistently predictive of pandemic difficulty. So as unit wards increased, so did difficulty. And the reason that unit years and seniority had an impact, it was those senior nurses that were relied upon so much for their experience, because the new nurses had no idea what was going on. The very senior nurses that were close to retirement, they've all left because they were tired and they decided they wanted to be with their family. So this tells us that the senior nurses really struggled through the pandemic. Okay, so those kinds of correlations and discussions are very important. Then when we look at residual trauma, we can see there was a real variance in what was predicting residual trauma. Did you want to see that? And then for sick time, this is the constructs. Now this is where it gets really interesting, because look at this one coming up. I'm going to talk about in a second. So now we can see that the outcomes, well-being of work, has a negative impact on sick time. So improving well-being at work will decrease your sick time. According to these data, that's especially true in Jordan, in Scotland, especially, okay? Now look at intent to leave. Isn't that a colorful slide? I think this is so fascinating. And this tells me that globally, well-being is important in every single country. And look at all those less than 0.001s. So, and I would encourage you, this is important, use your country study that you have, because you all each have your own country study. Use that and to compare to these slides into the international report and to this recording, okay? Because you want to make sure that, so this is what we're dealing with, but so is everyone else. So we as a collaborative want to be able to decide what is most important. Now, generally, the most important variable is job satisfaction, all the subscales combined. Remember, in this global, it predicted about 28% of intent to leave. But some of the other things were country, so that matters. So there's other things that are predicting it as well. But this is a very important slide. So our hypothesis was supportive. Okay. So here is our outcome of pandemic difficulty. So you can see, for example, Scotland, all of these constructs positively related to the pandemic difficulty. So as satisfaction with autonomy, for example, increased, So did pandemic difficulty. But what did we just talk about with the senior nurses? Those are the ones that are practicing autonomously, but they're having to help so many people and all these new nurses. So it's really tough. And then when I presented the data to Jordan, I didn't understand this, but they understood it right away. So and I don't remember Mohammed's review. I have the recording, but it was very interesting to see the discussion in the context, because only those who live the context can explain these data, not international researchers necessarily. And this is post-residual drop. So you can see intent to leave and trauma. Those are the two things that are most predictive by well-being. So here you can see, for example, US Trinity, as well-being increased, their difficulty post-pandemic is less, but there's much more red than black. In Turkey, you can see that it's positively correlated. So as those things increase, residual trauma also increases. So again, you can't rely on the global data in many of these outcome examinations, because you have to talk about your context.